Medical news from Lancet, London, England. The impact of Chile's multipronged food labeling and advertising law on early childhood excess weight, a cohort difference in differences study. A significant reduction in excess weight among young children has been observed following the implementation of Chile's comprehensive food labeling and advertising law, which features black octagonal front-of-package warning labels and marketing and school restrictions. This finding matters because it provides crucial evidence for policymakers worldwide who are considering food environment policies as a strategy to combat the childhood obesity epidemic. The law's impact on early childhood excess weight is particularly important given the long-term health consequences of obesity, including increased risk of chronic diseases such as diabetes and heart disease. The burden of childhood obesity is a significant public health concern, with millions of children worldwide affected, and previous studies have highlighted the need for effective interventions to prevent excess weight gain in early childhood. The Chilean food labeling and advertising law, implemented in 2016, was a pioneering effort to address this issue through a multi-pronged approach, but until now, there was a knowledge gap regarding its causal effect on health outcomes. This study was needed to fill this gap and provide evidence-based support for policymakers considering similar food environment policies. The study employed a cohort difference in differences approach, using national administrative data from the Chilean National Board of School Aid and Scholarships, covering over 300,000 school children aged 4 to 6 years across public and publicly subsidized schools nationwide from 2012 to 2017. The analysis compared unexposed cohorts, who entered pre-kindergarten in 2012 and 2013, with cohorts exposed to Phase 1 of the law, who entered pre-kindergarten in 2014 and 2015, during pre-kindergarten, kindergarten, and first grade. The primary outcome was a binary indicator of excess weight, analyzed using logit models and reported as marginal effects. The study also conducted subgroup analyses by children's school type, school area, maternal education and age at childbirth, birth weight, and gender. The results showed that exposure to Phase 1 of the law led to significant reductions in the probability of a child having excess weight, with children exposed during both kindergarten and first grade experiencing the largest effects. Specifically, girls had a 2.85% lower probability of excess weight, while boys had a 2.4% lower probability. The study also found significant effects after 6 months of exposure, with girls having a 1.91% lower probability and boys having a 2.24% lower probability of excess weight. The magnitude of these effects is notable, given the relatively short duration of exposure and the large sample size. The study also found significant subgroup effects. Although these were not extensively detailed, the overall pattern of results suggests that the law's impact was broadly consistent across different subgroups of children. The findings have important implications for clinical practice, as they suggest that policymakers can use food environment policies as a scalable and impactful strategy to prevent excess weight gain in early childhood. This, in turn, could inform the development of guidelines and interventions aimed at reducing the burden of childhood obesity. The study's findings should be interpreted in the context of its limitations, including the potential for unmeasured confounding variables and the fact that the study only examined the effects of Phase 1 of the law. Nevertheless, the results provide strong evidence for the effectiveness of Chile's comprehensive food labeling and advertising law in reducing excess weight among young children, and they have important implications for policymakers and healthcare professionals seeking to address the childhood obesity epidemic. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.